Good morning, everyone. My name is Dr. Pranay Reddy, and I'm a clinician who will be discussing yellow fever virus today. This is my seminar on the yellow fever virus. So first, I want to talk a little bit about what this seminar will cover. First, we're going to go into the background on the specific disease itself, a little bit more about yellow fever virus, a little bit about the family and genus of that specific virus. We will then move on to the modes of transmission. Specifically, this is a mosquito-borne illness transmitted by mosquito bites to humans and primates. We'll talk a little bit more about the predominant signs and symptoms. We will then move on to the diagnosis of the disease, both in the early and late stages of the disease. We will talk about high-risk groups, or what particular population demographics are at greatest risk for contracting this disease. Next, we will move on to prevention strategies, mainly vaccinations, and then we'll also talk about ways that you can counter the illness at the level of the mosquito. And then finally, we will talk about case management, or how we treat cases of yellow fever. So first, I want to talk about a little bit regarding yellow fever virus itself. It is an RNA virus caused in the Flavivirus genus. That specific virus is part of the Flaviviridae family. Interestingly enough, this specific genus of Flavivirus, contains other well-known viruses such as dengue fever, Zika virus, as well as West Nile virus. It is a vector-borne disease spread by mosquitoes, most primarily spread by the Aedes aegypti mosquito, which we know also spreads numerous hemorrhagic fever viruses throughout the Caribbean. And a little bit about the symptoms. It mainly presents with nonspecific vague symptoms that can be constitutional in nature. And then if it progresses to the second stage or toxic stage, it can actually cause end organ damage, mainly the kidneys and liver, causing jaundice and bleeding. Distribution occurs throughout the tropics and subtropics. We see this mainly affecting continents like Africa and South America. And I think the most important point is that a vaccine does exist. It is cheap, it is affordable, it is very accessible, and it is a great way to prevent this disease and prevent further outbreaks. So the transmission, we're going to go into the general way that this is transmitted from mosquito to primate or human. It is transmitted primarily by the Aedes aegypti mosquito. There are several other mosquitoes that can be the vector in this case, but the Aedes aegypti is by far the most prominent. As with other arboviruses, the viral agent is actually taken up by a female mosquito following ingestion of blood from an infected human or primate. The viral replication actually occurs in the gut of the mosquito, and then after replication, it enters the hemocoel, which is just a fancy way of saying the blood system or the circulatory system of the mosquito itself. It then migrates to the salivary glands, where it's stored until the mosquito feeds next on its next human or its next primate. And during this specific feeding, it will transmit the virus or disperse the virus into the next host. From here, the virus is transmitted to the next human primate, the mosquito from which the mosquito feeds. Now, that is the general transmission, how it actually works from the mosquito taking up the virus to transmitting it to the next. I think it's important to also talk about the three different types of transmission cycles that we witness that yellow fever tends to follow. The first is called the sylvatic or jungle fever transmission, yellow fever transmission. It occurs typically in tropical rainforests where monkeys are the primary reservoir. Essentially, the monkeys are bit by wild mosquitoes, meaning that they are replicating and breeding in the wild, not around household environments. These mosquitoes then transmit the virus to other monkeys, and then occasional human spread can occur, particularly with humans that are working in close proximity to these areas. The next type of transmission cycle is called the intermediate yellow fever transmission cycle. It is where semi-domestic mosquitoes, meaning that they breed in the wild and in household environments, infect both monkeys and humans. There's an increased contact between mosquitoes and people, and this causes a ballooning or massive elevation in the infection and transmission rates. It's important to note that this is the most common type of outbreak in Africa in regards to yellow fever. And then the last type of transmission cycle is called the urban yellow fever transmission cycle. It's where large epidemics occur when infected people introduce the virus into high population areas where large mosquito densities exist. So another thing that confounds this or makes this worse is that we see low vaccination and immunity rates amongst these areas, and that causes an increased infection and thus transmission rate. This is a main person-to-person mode of transmission. So we'll talk next about the signs and symptoms. It's important to talk a little bit about the viral incubation period. That time period is 3 to 6 days, where most people are actually asymptomatic throughout that time. If they do develop mild symptoms, they can see fever, myalgias or muscle pain, muscle soreness, backache. Backache is actually a pretty predominant symptom that is mentioned, a severe backache. Headache, loss of appetite, as well as general GI malaise and upset, including nausea and vomiting. Symptoms typically disappear after 3 or 4 days from the initial onset. Now, it is important to talk about the next potential secondary, or what's known as the toxic phase. A small minority of patients can actually enter this phase, and the toxic phase, as it's called, typically starts within 24 hours after the initial symptom recovery. That's important. This phase is characterized by a returning high fever, and then we see eventual end organ damage, specifically the kidneys and liver, and then the resulting jaundice or yellowing of the skin, hence the name yellow fever. We can also see bleeding from different orifices and internal bleeding, dark urine, abdominal pain with accompanied nausea and vomiting. Now, it is also very important to talk about this final statistic that I've listed, which is that 50% of patients who enter into the toxic phase actually die within 7 to 10 days. So it's very important to recognize the symptoms of this disease before they ever enter or have the potential of entering this secondary toxic phase. Diagnosis can be difficult in the early stages because, like I've already mentioned, the disease can present with very nonspecific, vague symptoms. So in the early stages, if we do suspect this type of illness, we actually use something called polymerase chain reaction to amplify or make millions and millions of copies of the RNA to better identify the viral etiology. Later stages, the difficult thing with the later stages is that these symptoms can often be misdiagnosed as other hemorrhagic fevers, for example, or malaria or leptospirosis, viral hepatitis. It makes the diagnosis a little bit more difficult, but if we do suspect yellow fever as the viral etiology, we can conduct different assays to detect the antibody presence. One such assay is ELISA, enzyme-linked immunoabsorbent assay, which actually uses the identification of a fluorescent antibody-antigen complex. So we should talk about high-risk groups. These are pretty self-explanatory. The main high-risk group are those that are not vaccinated. The next group are immunocompromised. Any patient that is either on some type of chemotherapy or has some type of viral illness that lowers their CD4 count and places them at immuno risk. Children, elderly, and pregnant women, all of the general high-risk groups that you would imagine. Prevention strategies. By far the most important prevention strategy is vaccination. The vaccine is safe, affordable, and a single dose actually confers lifelong immunity. So it is a very effective way of limiting the transmission and infection rates. And then if we vaccinate multiple people, we can actually confer a herd immunity. This is highly effective in urban areas where there's high densities of people. The next prevention strategy that we have is means of mosquito control. So we can eliminate breeding grounds, we can kill the adult mosquitoes and larvae using insecticides. This is particularly effective in high density areas where we also see, in addition to high populations, we see high densities of mosquitoes. This is something that was done all throughout Africa. Community involvement is by far a pivotal and crucial strategy to use that culminates all of these aforementioned strategies. The main thing that we're trying to control here and use the tools within the community are preventing or eliminating the breeding grounds of the mosquitoes, mainly stagnant water collections, household drains, anything that can collect water and serve as a reservoir or a breeding ground for these mosquito larvae. So case management treatment, like I said, the main thing to prevent the exposure in the first place, or to act as a means of primary prevention, is the vaccine itself. But if we get to a point where there is active illness in a person who is not vaccinated, supportive therapy, supportive means of hydration, electrolyte replacement, that's the main thing that we can do, the main management that we can carry out to improve survival. Currently there is no antiviral specifically for yellow fever, so there's no way to completely reverse or kill the virus once it has infected a human. What we can do is minimize the effects of, for example, dehydration. That seems to be the main culprit when we see end organ damage, specifically liver and kidney damage. So it's very important to practice great supportive therapy when you have a case of suspected yellow fever. These are my references. I hope you enjoyed this presentation. This is my seminar on yellow fever. Please feel free to reach out with any questions, concerns, or ideas. I look forward to speaking with you and working with you in the future. Thank you and have a wonderful afternoon.